I'm talking to Dr. Dixie Melillo today and trying to get her to use the microphone in the way you're supposed to be using it. So I'm going to apologize to our listeners going in if we have some in and outs because she gets so excited she just starts moving all over the place.
Well, this thing makes me cross-eyed. It's so close.
Well, look at me then.
Oh, okay.
All right, we were talking about your favorite patient.
Well, I tell you what, when I mean,
Well, not favorite, but someone who's a hero.
I see a lot of bad patients, and then they ask me, do I have a chance? Is there any way I can beat this?
You see a lot of patients that are in very
advanced. And
stages.
I said, yes. I said, only God decides when you're out of here. I said, I have a lady, and I still see her. I have a lady in 2010, and I have pictures, okay? Her cancer was so large, it was coming out the side of her chest. I mean, it was as big as almost a football. And she had let it go because she had had a lot of unhappiness in her life. And, I mean, she knew it was there, but she just didn't want to deal with it. She was having all sorts of home problems. Well, finally it got to where and these things smell really bad. I mean, you can walk in a room with somebody with this and with their clothes on, and it's dead flesh.
You know
it's
it.
rotting flesh. So she came to me, and we had a come to Jesus talk. And I said, now, the thing is, you got to decide you want to live. You know, if you don't want to live, there's nothing anybody can do to make you. I said, but if you really you've turned it around. Because she found out really she wasn't hurting her husband. She wasn't hurting her kids. They didn't care. That's how she got in that place. I said, now, if you don't care about you, it won't work. I said, but if you care about you and you want to fight, we will do it. So, I mean, she went through everything you can imagine, mastectomy, chemo, radiation. She is cancer-free now, 15 years later. She comes to see me about every 6 months, and they keep telling her, you don't have to go see Dr. Melillo. She says, oh, you don't understand. It makes her happy. No, that's the truth. And I tell her, I said, as long as you come back and I see you and you're doing good, I can honestly tell these patients, there's always hope.
There's always hope. Yeah.
There's always hope, It's, and I've seen miracles many times. Mm-hmm. I mean, even some of the people who used to volunteer for us, we thought they would never make it, and they did fine,
Yeah.
But, you ain't out of here till God says it's over, so.
That is so true.
If you want to fight, the body has miraculous healing ability. Now, it's got to have help in that kind of a situation, but.
Yeah.
So many times I've seen things, people I never thought would make it, made it.
All right, so let's go to the next question here.
Okay.
The hardest conversation you ever had with a patient?
The hardest conversations were when I tell people they have cancer and I don't have anything, no place to send them and nothing I can do for them.
Wow.
Or they have to go through the clinic system for 6 months before they can get charity care. That's the craziest stuff I've ever seen in my life.
And it is a real issue with us right now. We spent the last year trying to find some other alternatives, anyone else that would help us with these patients. So many times, our ladies don't qualify for a breast and cervical cancer program because they make too much money. Now, you have to remember, 200% of poverty is almost nothing. But you could make, if you make $25 over, and it's a household income, or if you have a teenager that's working, at some fast food place, hey, that money counts too, and you can easily get over that limit. So this is our biggest challenge right now, finding treatment for people who are working 2 and 3 jobs.
And if you don't live in Harris County?
Don't live in Harris County.
And you don't qualify for Medicaid, what?
Yeah, there isn't anything else. So,
I mean, it's just, it's insane. You just can't do that. Humans that way,
Feels like we've gone back in time.
Oh. Yeah. I feel kind of like I did back there in the 1980s when we're sitting there, what are we going to do? And
then Dr. Hawk would show up, or somebody else would show up, or we get another doctor to help us with a surgery or whatever. But that time is long gone. There has to be a better way.
Yeah. I don't know.
So talk about being a woman in this job.
Well, I think I think it's very important, you know.
That
and,
we're
and
women, or that
that we're women,
okay.
that, and, you know, the male doctors they're very kind and caring, but, you know, I hug my patients. I mean, and I hug my patients. I kiss my patients. They cling to me like little children crying. You know, I just I don't think a man would be as comfortable doing that.
Well, there's a lot of reasons why they wouldn't.
Well, I
It
know.
has
Oh,
nothing
God.
to do with
Don't touch me.
being
Don't look at me.
compassion.
I know. But no, I mean, sometimes people just need to be held. You know, and I do that. I mean, the minute they reach out for me, I hold them.
But do you think our almost all female environment has made a difference in how the rose has grown?
Yeah, I think so because it's just a fact. Women are more compassionate.
I think we work harder.
Yes, right now.
And we're not saying it because we love
No.
all the men in our life. We love every donor, every volunteer, our husbands, our kids. So it's not any of that. It's just that
Well, I
women
think we're
are
more passionate about what we're doing, which makes you work harder. I think across the board, if women don't really like what they're doing, they don't work harder. You know, they can be very unworking.
Yes, that's true. That's true. But I think it's just a different perspective. I think the other thing that has been with both of us is that we've been poor, and that we know what it's like
Yes.
to not even expect anything.
Yes.
You know, to then go around others that have things you never even thought about having or are treated differently.
Yeah.
You know.
Well, I think my greatest eye opener was at the time it seemed like an absolute disaster, but it set me up for what I'm doing. When I got pregnant, and my husband and I, my mother went to his commanding officer and decided we would get married, and so we got married. And then when we moved back to the States where his folks were in Connecticut, I mean, I never went to the doctor. I couldn't afford prenatal care. I didn't take any prenatal vitamins. I didn't see anybody. And, you know, his mother had 10 kids. And when labor started, she got on the trolley and went down to the Yale New Haven Charity Hospital to have her children. And then they called Papa to come and get her when she was ready to be discharged. I mean, this was a very hardy group, you know. And when you know, we went to this hospital funny story though, my husband was sitting down having a beer at the corner bar, and I walked down there. I was in so much pain with my labor pains. I walked down there and I was big as an elephant. And I said, I think I need to go to the hospital. I'm having a lot of pain. And he said, oh, sit down and have a beer and some peanuts, you know. And I said, I really think I ought to go. Well, my water broke right there on the barroom floor. Then he believed I had to go. He said, okay, all right, if you're going to make a mess, I'll take you. So we had to drive the 20 miles. It was like going to the charity hospital downtown Houston. And so I had no maternity. I had bought one maternity outfit to go to the doctor's in, and I took it to come home, and of course the dog chewed it up in the car. But anyway, it was like we had to walk all the way down to the hospital because we had a 53 Buick that had no reverse. So we had to park about 10 blocks away in a place where we could keep going. And I was walking in the rain to the hospital, and I was so worried that people were going to think my feet were, this was in April, that my feet were dirty because I had water spots on them. And when I went in there, they said, okay, you come on in, and told him, go home. You know, nobody waited. You couldn't, if you were a charity patient, no one could stay there with you. And so here I am, you know, 16, crying alone in this place I've never been, and I hurt. And this big old mean fat nurse come up. She said, well, honey, if you'd kept your legs closed, you wouldn't be in this position. And, you know, you can't pick up the cell phone and call your mama. You know, you were there. You were there alone. And there were so many, this is Yale New Haven Charity Hospital. And there were so many people giving birth in April that I was on a stretcher in the hallway. You know, the wards were like, you know, 20, 30 people. You never had a private room, But in the hallway, it was so. And every shift change, I was introduced as the troll off the street that had no prenatal care. Do you
Say
know
that
how that makes
again.
you feel?
Yeah, say that again.
The troll off the street that has no prenatal care.
Oh,
I mean, it's so degrading, and you're so alone, and you hurt. You hurt. And, I mean, I did normal childbirth before it was popular because they didn't give me anything, I mean, and honestly, I had a 4th-degree tear, which wasn't repaired till I had my second son. And I won't even go through the wonderful things that happen when you have a 4th-degree tear. But then we were in this, after he was born, we were in this enormous ward, probably about 20 people, and every baby was at the foot of the bed in a basket. There wasn't no like nursery unless it was in desperate. You had to get up and take care of your own baby. If you put your baby down to sleep, then you had to get it up. You had to do everything right there 5 minutes after you gave birth. Of course, no, we were probably in the recovery room maybe for a few hours or something, make sure the baby was stable. But I mean, right then and there, I decided charity care was not good. I don't want anybody to have to go through that. I did one bad thing. No, I would pick up my baby. Little Ralph had such gorgeous black hair, And I always remembered later, it was a commercial later on, it said, too bad you had to get a bald one. And I would show him to all these people how beautiful his hair was. But anyway. But no, I mean, those things, at the time, it seemed like, what a disaster, My parents had always loved me. We'd never been rich, but man, I never had to go through anything like that. He was in the Air Force, and we had the Air Force hospital right there waiting for us. Problem is, they were stationed in Germany, and he couldn't just get up and leave.
Right.
And when Ralph and I got married, he had to come home, and so I had to come home with him. It wasn't like a choice that I could stay in Germany even.
Right.
But it was a good thing because it taught me, look at what people go through. Look at what you don't want for health care. It burned in my brain that I don't want to ever have people treated like that. I mean, all the things that sometimes seem like the worst disasters really turn out to teach you something, to make you a better person, to help you make other people better. And,
Dixie, I think you always say that, and I could think of many stories that are related to who we become, where we end up. But, I remember when I was a young woman and I just had David. My mother had died, brothers, sisters with me. But I had to make some money. And, I had too much at the house to leave much. And it was a time before women really worked. But I took in wigs. I cleaned and styled wigs. And you can't do that anymore. You have to have a license and stuff. But, that was one of my 5 jobs that I had. But I think when we started the Rose, and I was the only one comfortable with wigs. Now, you don't probably remember this, but, they didn't know how to wear them. They didn't know how to use them or how do you style them. And I thought, isn't that interesting? That's one little gift that God made sure I knew how to do so that we could do it for those that really needed it.
Now we have a whole wig room.
Oh, I know. But it's amazing the things that, like you said, always seem like disasters that aren't.
Well, and when you look back, you can see there's been a plan for your life all the way along. So, I mean, I try to tell young women that, just learn from everything that happens. Don't fight it.
Right.
Just learn and accept and
sometimes if you can step outside your life yourself, you can see it in a different way. It really it is really so true. We get prepared.
Yeah, and I mean now, the things that would have just thrown me upside down when I was younger, now I go, oh, okay, how's that working for you, I mean, I just, you learn to be an observer,
And we've certainly had a lot of characters to observe in our life.
Yes, in our
Yes,
family,
yes. All right, so let's talk about what is the biggest misconception people have about the Rose.
Well, I think they think we're a charity care program and they don't send us their injured patients.
I
Come
know it.
on. Come on, gang. I mean, it takes insured people to run we take every 3 insured will pay for a mammogram for an uninsured. And I know a lot of these guys, they send their paying patients to the hospital imaging centers, but let them get someone who can't pay or that. Send
They
them.
know about the Rose immediately.
Send them to the Rose.
Yeah.
Which I'm glad they do, but they really ought to realize we are a top flight center, a center of excellence. You don't get that by just dragging your feet.
No. We do. We have the best equipment. We have physicians that only look at breasts, are always, they know what they're looking at. They know what they're seeing. Makes a huge difference. We can always tell when someone has a new radiologist that's come on, because then they'll start sending to the Rose for lots of biopsy reviews. And, you know what I'm talking about.
Biopsy review only means that they need a biopsy, but they've charged the patient so much the patient can't afford them, so they come here. It's not to get a second opinion on whether they need it. It's to go to a place where they can afford it. And I'm proud. It doesn't hurt my feelings. But, healthcare needs to wake up. It shouldn't be just a privilege for the people with money.
No. That is so
Healthcare ought to be just the right of everybody. But I think the reason our healthcare system is so awful is because we treat the symptoms. Nobody goes back and say, hey, they pull the people out of the river, but they don't go back and see why they fell in. Come on. Most of this stuff could be prevented, but they won't let the word get out. If I can be...
How much nutrition training did you get when you were a doctor?
Only how to do TPN for the people who couldn't eat.
Oh.
That was it. Okay?
How much do you think there is today?
None. Still. None. I've talked to these young doctors that are coming out. They don't even know what visceral fat is. And it's dangerous. And it causes disease. They say, oh, no, it's just a body type. It's hereditary. They say diabetes is hereditary. Nonsense. The crap you eat is hereditary. You eat the same thing your relatives did, and that's why diabetes runs in your family. Come on.
Well, it certainly will be nice when you get your hospital and you can really focus on this, Dixie.
And I can really say what I think, huh?
Yes. Dixie, you see some of the most interesting cases, patients, situations.
I saw Merkel cell carcinoma.
So what?
Merkel cell on the breast.
All right, explain that to us.
That's what got my hero, Jimmy Buffett. Merkel cell. It's a skin cancer that grows out, and it looks like a half of a little raspberry sitting outside the skin. Of course, I had to take a picture, but, do we see stuff that, heavens,
That's just rare.
Oh, yeah.
How many cancers and fibroadenomas did you see?
I have a 20-year-old. Yeah. She had a big, huge fibroadenoma. I have a rule, over 3 centimeters it should go. Well, this child had a 5-centimeter fibroadenoma. I said, no, that's got to go. And it had been core biopsied. It said fibroadenoma. Well, when it was removed, it had ductal carcinoma, lobular carcinoma, and malignant phylloides in this thing.
Oh, my gosh.
Yeah.
Wow.
At 20. And that's been 10 years ago. So, I mean, I'm very respectful of the breast. You take the R out of breast and you have beast. And it will get you if you don't respect it.
That is true.
It is. And it's just getting more and more complicated.
Well, did you always say if we could figure out the breast cancer, we'd figure out any of them?
Oh, absolutely. And breast cancers, they have 6 to 7 times more insulin receptors than a normal breast cell. Any cancer that you eat is going to get sucked right into the cancer first. And I just beg my patients. I said, now, when you go through treatment, please, cut the sugar. Well, I told you about my ex-husband. I mean, now he passed away from a blood clot to his brain, but he was diagnosed with pancreatic cancer, stage 4, liver metastasis. this man was a neurosurgeon, Jim, and he about 3.5 years ago, he called me up. He says, and we've always been good friends, you know. He texted me. He said, "Guess this is it, kid. They say I've got 6 months to live." And I sent him Thomas Seyfried's work on the metabolic handling of cancer, and his oncologist was trying to funnel him sugar, you know. And but he listened. He read all of this stuff, and he's a smart man. And he went from like 240 pounds to 155. But he lasted about 4 years, and he had a stroke, which was nothing to do with this. But he sent me CAT scans. The reports, the tumor no longer took up any. His tumor markers went down to normal. The tumor was, I mean, it was there, the shell of it, but it wasn't taking up any sugar or anything, any of the dye that they inject. The 3 liver metastases, they shrunk a little bit. Now, this is not a cure. I mean, I'm not saying this is a cure, but he said he'd never felt better. He was out flying his airplane and playing his trumpet in a little bar in Austin. And, I mean, we kept tracking, and then his wife let me know that he'd had a blood clot, and they'd tried, but I mean, he went the way he'd want to go.
Oh, yeah.
He didn't sit. He had no pain.
It's all about quality of life.
Yeah.
Yeah. And that is one thing I think we could say for a lot of people. The Rose being here really changed, not just saved a life, but let them have a different quality of life.
Yeah, and some dignity, and you know,
and some hope.
Yeah, there's always hope.
Always
hope.
Hope.
See, my shirt says hope.
Always hope.
I'll always have hope. Till the good Lord beams me home.
All right. Well, Dixie, let's hope that's not very soon at all, because you got a lot more stuff to do.
I know. That's what everybody says.
Yeah, you got a lot more to do. All right.
And I'm going to do it, too, with everybody's help.
All right.
That was good.
That was good. Until we do this again.
Yes.
Saying goodbye.
When we open the hospital, she'll be there for the ribbon cutting.
Let's talk about your breast.